Hi everyone, I need to share a story about what had happened to my child lately. My child Sarah. Sarah is 8 years old. She didn't have any medical concern except she have seasonal allergy. She might have itchy eyes during season changing. She has regular doctor checked in June every year. And she's not afraid of that at all. Last month, she has been in the dental office to have her teeth cleaned and fluoride applied. One day, I suddenly saw she has broken skin on her chin right under her left side of her lip. I asked her, and she said she was accidentally scratched her face due to having long fingernails. I think, okay, that is normal. It should be healed in couple days or week. 2 days later, I saw there were a couple more redness sore around her lip. Because I saw her eat hot Cheetos before, I assumed it might be from hot Cheetos. However, on the next day, I saw more fluid-filled blister, burst, yellow crusted patches spreading around her lip, nose. I wonder why. I was more worried when I saw her keep scratching those areas with her bare hand. She seems really itchy with those. She seemed uncomfortable, painful. That's why I decided to bring her to check up with her doctor. This is picture of her. After checking with her doctor, doctor said she has impetigo. I also let her dental hygienist knows about that because I want to have more explanations about what impetigo is. I'm Quinn. I'm a dental hygienist who is responsible for taking care of Sarah's oral health. As a healthcare provider, I want to make a plan to help my patients arrest the disease. Before talking about the plan of the treatment, I will explain about what is impetigo. Impetigo is a common and contagious skin infection. Bacteria which causes the disease are Staphylococcus aureus, often in combination with Streptococcus pyogenes. Infects the outer layers of the skin called epidermis. This bacteria can get into body through a break in the skin from cut, scratch, insect bite, or rash. They can invade and colonize. Impetigo appears mainly on the face, but also can develop on exposed areas of the arm or legs. Anyone can get impetigo, but it most commonly affects children. Patients can catch this bacteria if they touch those sores of a person through direct skin-to-skin contact or touching items like towels, clothes from that person used. The first sign of impetigo are reddish sores on the skin, often clustered around the nose and lips, which may resemble recurrent herpes simplex infection. Impetigo spreads faster and never develops inside the mouth, while herpes appears red sores in the mouth. Impetigo sores quickly grow into blisters, burst, and then form a yellowish crust. The clusters of blister may expand to cover more of the skin. Sometimes the red spot just develop a yellowish crust without any blister being seen. These sores can be itchy and occasionally painful. After the crust fades, they form red marks that fade without leaving scars. Impetigo can be uncomfortable. It may involve swollen glands in the area of the outbreak of a fever. Because impetigo is infectious disease and can be contagious, it is a good idea to see your doctor right away if patients suspect impetigo. Doctor can usually diagnose the infection by examining it. Lab tests can be taken by dermatologists. Dermatologists often prescribe an antibiotic that you apply to the skin, such as mupirocin or retapamelin. After experience in Impetigo, Sarah may need to stay home from school for a few days. Skincare plays an important role. Apply the antibiotic as prescribed. Cover the skin with the gauze bandages to help it heal and prevent spreading the infection to the others. Avoid direct skin to skin contact with others. Wash their hand after touching or treating infected skin. If you are not near the sink, an alcohol-based hand rub will work. If patients follow the treatment plan, impetigo is usually no longer contagious within 24 to 48 hours. It can reduce the length of the illness to around 7 to 10 days. Without treatment, impetigo often clear on the own in 2 to 3 weeks. During the time, there is a greater risk of developing complications. Based on Sarah's situation, as a healthcare provider, I would like to recommend that parents need to notice on their children with any small signs or symptoms presenting with contagious diseases in pedigo. Recognizing it early can prevent the spreading of the disease to others and reduce pain discomfort for patients. Thank you for watching.